This is the inaugural podcast of the Commander's Commentary program at the 501st Combat Support Wing. I'm Technical Sergeant Aaron Thomason, and I'm sitting here in our studio talking to
Lieutenant Colonel Beth Hoettels.
All right, and so what we're here to talk about, and of course, Colonel Hoettels, you're at the Medical Squadron, right?
Yes.
So you've had a very interesting career, actually. I know that maybe sometimes people think that in the medical squadron, it's just all just doing paperwork and checkups and stuff like that. But that has not actually been the course of your career, and probably not really the course of anybody's career in medical. I think that's sort of a stereotype. So,
Um, as far as working in medical, I started originally in the Army in the Medical Service Corps as an administrator. So I did 10 years as an administrator doing some more of that paperwork type of stuff. But I also worked with public health and did a little bit of medical. So that's where I got my feet wet in medicine. I went back to nursing school, joined the Air Force, long story, and started out clinically, intensive care nurse, ICU, or trauma nurse, ER. But then I've also been able to do some other things uh, I've been able to be a flight commander. I've been able to go out on the surgical team, and I even got to pull together some of my civil affairs work when I was in Iraq as a nurse, and I started their outreach program for them. So I've been able to do a little bit of everything. I've been afforded, I always say, the wrong place at the wrong time. Everyone says right place at the right time. Sometimes like, oh, maybe wrong place at the right time, or wrong place at the right time. I don't know. Found myself in those places and just jumped on the opportunity and grew from it. So
fantastic. Yeah, I mean, it's a very interesting sounding career. We came here to talk today about was sort of your perspective on leadership. And one of the things that I asked, before we did the podcast, was just times that you've learned about like a new leadership lesson in just your day-to-day life as an officer, as a medical expert, and that you've been able to apply something.
I remember having some challenges, and my father was in the Army Medical Service Corps, and I remember having a challenge with some leadership, and I was trying to get some people to do some stuff, and my father said, "Elizabeth, you can never ask somebody to do what you're not willing to do yourself." So I've kept that since I was a lieutenant. So while I can't be a dentist, I can't actually be a physician, I'm willing to try what everybody else is doing. I get uh, going to go work at the front desk or going to go help out and give flu shots. I can't ask people to do things that I'm not willing to at least try myself. Even if it means, go do police call, let's go clean up around the building. Sorry, police call is an Army term. We do area beautification. Like, I can't expect people to go do it if I can't go do it myself.
Right, right, and that's very true. Something that I see a lot in my life is people achieve a certain rank, and well, I don't want to say a lot. That's unfair. Occasionally, I have seen is that people achieve a certain rank, and suddenly they're too good to take out the trash, or something like that. And just for myself, I don't think that's really an effective way to lead. And I think a lot of other people, clearly you as well, think along those same lines.
If there's a job that needs to be done, it doesn't mean that I can't help you do it. And sometimes I'm always like, look, I've got two good feet and two good hands. I can totally help you. And if it means I go and spend some time doing area beautification and I do some other stuff later on, that's totally fine with me. I would rather do what they're doing because it also helps you understand. You At least in the medical field, there's so many different professions. Whether you're a lab officer or your administrative officer, there's so many varied options that you can't maybe do everything that they can do, but there's plenty of things you can do. So if you don't get out and do things with people, um, they are they're probably less likely or less apt to trust you.
Yeah, and I mean, I would agree, and I think that's also in line with something that Chief Goldfein has said before in some of his speeches. The value of engaged leadership. That to use the trash example or the area beautification example, not just that you're willing to do it, but that you're willing to do it with the other person, your subordinate. Or your peer, or whatever is the case may be, and that there's a lot of value to be gained from there, from just interacting with them doing the same task.
Well, this way you also get a chance to meet people and talk with people. I probably One of the things I really enjoy about being nursing or a nurse is that I get to spend a lot of time with people. I get a chance to really get to know them and talk with them. I still see things that I did clinically, spending 12 hours on a shift with you. I see that as I've progressed, even in a leadership role, still would rather be out with people and spending time talking to them. Um, and seeing what they're doing and getting to know them. That's been one of my favorite things of nursing. Nursing's just not making sure that I'm getting you well. There's a whole entire system, and unless I ask you questions, I don't know what that system is.
Yeah, and one thing I think that connects very well to medical is to say that in a ER environment, obviously there's a leader of some sort, in the surgery, but that's a very high octane kind of working environment. It's sort of a pressure cooker, I have to assume. And many of us, we spend our day-to-day lives working in an office somewhere, or for some people, out on the flight line or something like that. But it's never really quite as life or death necessarily as an operating, like a surgical room, I guess.
Oh, whether surgery or in the ER, one of the challenges is that we can impact somebody's life, like literally their life. We joke, or people will hear me say, well, is it life, limb, or eyesight? Well, I might not be so worried if it's not. And probably because I grew up in a medical, I'm worried about your life, limb, and eyesight. And then I prioritize based on that. I still prioritize everything else, but um, as medics, in leadership, like, our job is really focusing on that patient. But you have to have good leadership to make sure that we are all effectively doing a dance in the ER. Everyone's got a place to be, or in the OR, everyone's got a place to be, and this is how we do safe patient care. So it's really important that that leader can organize and have that trust. But that's also going back to talking to people. You spend time working with your surgical tech, or you spend time working with your ER medics, and that way you know them, what they're capable of doing, and that even if it means everybody does it together, they know that, hey, you're willing to put forth whatever effort as the leader in whatever aspect you are in the ER. If that makes sense.
I mean, I think it makes fantastic sense, because like you were saying, it's these leadership things that we talk about, they're not really abstract necessarily. And sometimes maybe they can feel like that, but in a really pressure cooker kind of environment, like an active operating room, all of a sudden they become very important and very concrete, in a way that maybe sometimes we don't see the value of all the time, but that is always there.
Working together as a team and having that leadership and understanding that we're taking someone, whether it's yourself or it's your family member. Everybody is important to somebody. Right. So having that in the back of your mind, like we are adamant with our leadership skills and knowing what our roles are and how our team works, because you are important to somebody. So having that in the back of your mind also helps.
Yeah, fantastic. So I don't want to take up too much of your day. Obviously, you're a very busy person. And so if there's anything, is there anything else that you want to talk about while you're here?
Lead from the front, learn something. Learn something every day. Don't be afraid as a leader to learn something. And it doesn't have to be your AFSC. You don't have to learn additional public affairs thing every day. You can learn something about history. You can learn something about cooking. Just learn something every day. Keep your eyes and ears open. I think that if you start practicing doing that, that helps you as a leader too. It helps you get to learn things and see things in new light, and that way you can see your people in new light as well.
All right, yeah, awesome. Thank you. I mean, it's a very insightful thing to say at the end. I'm sad that it was said at the end because we could talk so much more about it, but the stuff that you mentioned. But at any rate, we won't take any more of your time out of your day. Thank you for coming on the podcast. You're the first friend of the podcast.
That's awesome. A little intimidating, but awesome.
And maybe we'll have an opportunity to have you come back and talk again because it's really been an excellent discussion.
Thank you.